This is Stan Kautstall, and I'm the Program Manager of the Health Profession Opportunity Grants Program. And it's my pleasure and privilege to welcome you to this webinar where we're going to be talking about the closeout of the performance reporting system, which is the data system used by HPOG. You probably recall it's been just a few weeks since we had a webinar on how to do final reports and how to request no-cost extensions. And this webinar was developed specifically for the evaluation components and the data components, but it was very much done in conjunction with all of the information that we've previously provided about the programmatic aspects. So I'm not going to be doing any talking today, but as you probably just heard from Nathan Sick from the Urban Institute, he will be talking and sharing a lot of relevant information, as will Gretchen Locke from APT Associates. So without any further delay, it's back over to you, Nathan.
All right. Thank you, Stan. And I'm going to go ahead and, well, firstly, just to introduce myself, my name is Nathan Sick. Some of you may have worked with me in the past. I work at the Urban Institute on the PRS Support Team, and I'm going to be helping out with the PRS closeout procedure in the coming year. And yeah, so I'm going to be talking about that portion of the closeout activities today, the portion that revolves around the PRS data system. PRS closeout. So as you all know, the HPOG grant is coming to an end, and the PRS with it will be closing out. So again, I'm going to be talking about a few different things today. Some of them are what you guys all need to do with regards to the PRS closeout and what your responsibilities are. And additionally, we are going to be providing you with all of your HPOG data extracts from the PRS. So I'm also going to talk about that process, how we're going to be getting that information to you, and what that's going to entail, and also a little bit about, you know, what you can use it for. So when the PRS ends operation, when it closes out along with the HPOG grant, you will need to have firstly entered all of your PRS data. So we're going to talk about the time frame for this in just a moment, but it's important that you make sure that whether you have an extension or not, a no-cost extension, that by the end of the grant you have entered all relevant PRS information for all of your participants. So we want to make sure that it's complete, your participant records are as complete as possible. You will need to provide the PRS support team with information to help you get your data extract. So again, we'll talk about that a little more later, but we're going to be providing you with the data extract of all of your PRS information, and we're going to need a little bit of information from you to help us out getting that to you. And the PRS support team will provide you with an extract of all of your participant PRS data. So as mentioned, that's what we're going to be doing for you. We're going to be making extracts, and we're going to be sending them to you so that you guys can have all the information entered into the system from the grant. So the timeline for this depends on whether or not your organization has been awarded a no-cost HPOG extension. So that's whether or not you will be continuing on for another 6 months. And we'll talk about the differences in time frame with that right now. So we have a timetable here for HPOG for grantees without a no-cost extension. So this will begin on the first important date is on September 29th, which is for those without an extension, that is when the HPOG program ends. So by that date, you need to complete all Year 5 participant services. Then a month later, on October 30th, the Year 5 PPR is due. So the same kind of schedule that has, that's been occurring for the majority of the grant. And you will need to complete all your PRS data entry and submit your Year 5 PPR on that date. So October 30th is really the best time to have all of your PRS data completed and entered, because that's when you'll be submitting your Year 5 PPR. Then on December 31st, we're going to have the PRS closeout. So that date is when grantees without an extension will no longer be able to use the PRS anymore. It will be unavailable. So that is the absolute last day when you need to have completed all of your PRS data entry by. It will no longer be possible to enter data for participants after that date. So then that is also the date when you need to enter your final PPRs covering the entire 5-year budget period, and also submit your final PPR. And then on January 30th, the grantees will receive your PRS data from the PRS Support Team. So we'll talk about when you need to provide us with a little bit of information to help get you those extracts, but the extracts will be available to you. They will arrive by January 30th, 2016. So,
hey Nathan, let me just interrupt because there's a lot of feedback on the line. So for those folks that are calling in, it would be great if you could mute your phone to eliminate some of the background noise. And sometimes there's an option to do *6 if there's not a mute button on your phone. I'm not sure if that's the case with this particular system, but please mute your phones.
Yeah, I'm very sorry. I normally would mute everyone, and I'm using a new version of WebEx, and for some reason that option is just not coming up. When I click on it, I get my camera. So I think something's wrong. Otherwise, I would have the lines muted, but as Sam said, if possible, please mute yourself. Apologies for the inconvenience of you guys needing to go ahead and do that. Okay, so moving on, and thank you, it is much quieter now. This is the timetable for, hold on. So we just went over the timetable for grantees without an extension. If you do have an extension, it's a very similar time frame. Everything is just, for the most part, shifted back by an extra 6 months. So the Year 5 PPR is still due on October 30th, and then the HPOG program will continue operations until March 31st of 2016, and that will be the day on which the HPOG program ends for grantees with an extension, and that's when final participant services need to have been completed. The last semi-annual PPR is due a month later, along with final PRS data entry. So again, that is really the date when you should have all of your PRS data entered by, but the PRS will remain available until June 30th, at which point it will be turned off for all grantees, extension or not. So that is the day of final PRS closeout, June 30th, and there will be no PRS entry after that date. So it's very important to have all of it completed before then. The final PPRs covering the entire 5-year budget period are also due on that day. And 1 month from then is when you will receive your PRS data from the PRS Support Team. So that is really the last interaction with the PRS that will occur, is when you receive all of your data that you've entered into the system over the last 5 years. And that's the main thing that we're going to be talking about for this presentation, that process of receiving your data. Okay, so what PRS data will I receive? This is kind of a long list here, and so we're not going to go over everything, obviously, but it's just to show that you're going to be receiving every bit of information on the participant and grantee level that you all entered into the PRS. So that will include new participant information like Social Security number. It'll include all of the intake forms, all of the random assignment information if you're a random assignment grantee, if you participated in the Impact Study. It will include all of the educational and vocational training activities, employment development, support services, exit and follow-up information, and also grantee data such as programs that you may have entered, mainly occupational healthcare training programs, as well as any vendors that you may have entered. We will also be providing case notes, which will come in a separate file with their own format, because those are a little bit different. You'll also notice on here that I say one-to-many sections are in bold. And what that means is that there are really two kinds of PRS data that you'll be getting. And one of them is one-to-one, which is forms such as the intake form, where there's one question per participant. So a participant has one date of birth, for example. they have one set of intake information, they have one set of exit information, and then there are activities that are one-to-many, such as training. So, for example, with health occupation vocational training, healthcare training, a participant can have because of that, here, I'm going to have to figure out who that is. Okay, apologies for that. So those two sets of information will come separate. You'll have one-to-one
Thank you for holding.
Together, and you will have one-to-many pieces of information together. Okay. Just a moment. Okay, just an FYI, anyone who's on the line, please do not put your phone on hold. So you will be getting those two sets of information, one-to-one and one-to-many, where one-to-many sets will have multiple entries per participant. For example, multiple training activities per participant in multiple rows. Therefore, those will be grouped together in your extract. How will your data set be formatted? You're going to each get two formats by default. One will be a standard Excel data book, which will be a single Excel file in the xlsx format with one sheet per data section. Headers will have a 32-character limit, and missing data will be encoded with blank cells. Standard Excel formats will apply. So you're going to get one big Excel data book. It'll have a lot of sheets in it, and the sheets will have PRS data on them. And that PRS data will be grouped together with some categories that we'll see in a second. The other format that you're going to get will be ASC2 CSV text files. So that is basically just a raw text file that is comma-separated values. So that may be something that some of you are familiar with. It's just a TXT file that can be opened with a variety of programs, including Excel also, but also with programs such as Notepad. So those files can be opened with a variety of programs. Okay, there's a specific reason why we're providing you with two types of formats. If you just want to use Excel and run any kind of analysis or create spreadsheets and data with Excel, that would be why we're providing you with the Excel data book, to be able to manipulate the material in a familiar format that you don't really need to change much to be accessible. But it will also have some Excel formats within it. So, for example, Excel automatically formats dates and various values such as that, which may make it a little bit incompatible with some statistical analysis programs. They may not be able to load in an Excel data book with lots of sheets. For that reason, we're providing you with a text file. The text file is just a raw data set, be untouched by any program such as Excel. There will be no formats in it, and you'll be able to read it into a larger variety of statistical analysis programs if you are going to be running that kind of analysis. So again, these will both be provided to you by default. Okay, so the data sections, I'm not going to spend much time on this other than to explain the data key. So with each extract, you're going to get a data key or code book, however you would want to call it, and this is going to allow you to interpret the data extract that you're getting. So you're going to be getting a relatively raw set of participant information that's going to have variables that won't be exactly the same as what you see in the PRS. So, for example, household income at intake may have a slightly different name, a similar name, but a different one in the actual raw extract that you get, and the data key is going to allow you to interpret that information. So it's going to include variable names, descriptions, allowable values, descriptions of those allowable values, data formats, and schema information such as skip patterns. So again, it'll have the name of the question that is in the PRS as you see it. So for example, is this participant a TANF participant? Then it will have the name of the variable that you're going to find in the actual data set. It will have the values that variable may have, so 1 equals yes, 2 equals no, etc. And it will also provide you with formats, like is this a date variable, or is it a numerical variable, or is it a character variable that may be a text field? And then it'll also provide schema information, such as skip patterns. So that's the data key, the top part of this. And again, we sent out some materials yesterday that do include all of this in quite a bit more detail. So you'll see an email from PRS Support that has a file with all of these breakdowns of how the data is organized. But essentially, it's grouped together. So you're going to get one Excel sheet that has all of the participant information on it. So it'll have, or that's all of the major intake stuff, and one-to-one participant information like demographics, contact information, random assignment, baseline information, exit, and follow-up. And then you're going to get sheets that have training activities on them, employment development, support services, grantee level information. It's all going to be grouped together in a logical manner. So, and then again, you'll have the data key there to interpret all of it. And we sent out the document yesterday, which has all of this listed in a great deal of detail, and there'll also be questions at the end if you have questions about this. So, process for receiving data for separate sites. So, we are providing an option for PRS data extracts to be requested by grantee sites. So that would be your subsites that you have in the PRS, right? You may have a grantee with one location. You may have an organization that has many locations. And we are providing the option of requesting data by those locations. Now, one thing that's really important about this is that a site variable is going to be included in the standard data set. So what that means is that what you're getting by default will allow you to separate information by location. So if your organization has 10 offices, we will, standard, be providing you with a data set that includes a column that will tell you which participant belongs to which location. So you will be able to easily separate that information by subsite or by location. So it is not necessary to request this option if you would like to analyze your information in that way. However, if each grantee site or location will be utilizing or analyzing the data independently, you may want to select this option. For example, if multiple offices are doing their own independent work and analysis with the data, then it may be advantageous to select an option where you get one extract per site. So the information I just mentioned, and I'll go into this in a little bit more detail, we would be sending one of those extracts to each location that you designate. So what is the process for receiving data? What do you need to do? So within 90 days of closeout, so within 90 days at the end of the PRS, which will be on December 31st, 2015 for grantees without an extension, and it will be on June 30th for grantees with an extension. Within 90 days of that, the PRS team will ask you for a person to whom final data are to be sent and their contact information, such as name, affiliation, mailing address, phone number, and email. So we will basically be asking for a contact person for whom we will be sending this extract to. So we need one specific individual who's affiliated with a grantee, and we need their contact information. And we will also need to know whether or not you will be requesting separate data sets by site. And if so, then we will need the above information, a contact person for each site. So we'll need a contact person to liaison with, their name, affiliation, mailing address, phone number, and email, but for each individual location that's going to be receiving an extract. And the data are confidential. So this includes social security numbers, very sensitive data, and it needs to be sent to a specific person for handling who will be abiding by data security protocols. So again, that will be, one person will be receiving the data, and they will be responsible for handling it. What will I receive? The data will go to the contact person via The data will arrive to the contact person via Federal Express, burned to a CDR. So you're going to get a disk in the mail via Federal Express. If multiple sites are specified, each contact individual will receive a separate disk. The data files will be PGP encrypted, which means that you will need a password to access them. And that password will arrive in a nondescript email from PRS Support. So once we have the contact individuals and we have their email address, we'll be sending them along a password via email for them to be able to access the data with. No special software is required to unlock the files, only the password. So to summarize, basically, we went over the schedule for PRS Closeout and when that will occur for grantees with an extension and grantees without an extension. The fact that you will be getting a data extract and how to request or how to give us the information that we need for us to provide you that. So that would be whether or not you need separate sites, and it would also be giving us a contact person and what you will be receiving. So a CDR in the mail with the data on it that is encrypted to a specific person, and it will have all of your PRS data on it. And that will be organized by whether or not the data was one-to-one or one-to-many. So that's it, and there's going to be time for questions about this at the end, and I think I've maybe run a little long. I'm going to pass it on to Gretchen Locke now for the evaluation portion of this presentation.
Okay, good afternoon, everybody. Again, this is Gretchen Locke. I'm the project director for the HPOG Impact Study, and I'm going to be talking about evaluation activities, both those that are wrapping up and those that are ongoing, and then we'll give you a preview of the reporting schedule for coming HPOG reports. I just want to mention that I'm joined on the call today by two staff from AppDesRBI. They are our survey group. So Ben Phillips and John Sokolowski are also on the call. We'll be talking a little bit about survey procedures, so if there are any questions about that, they can help answer those. Okay, and Nathan's going to move the slides for me. So next slide, please, Nathan.
Okay.
So we're going to talk first about some evaluation activities that are wrapping up, and there have been some questions that have come up from grantees about document retention. What are we supposed to keep? So there's some just kind of pointers here in terms of consent forms. You should keep hard copies, whether originals or copies, in a secure location. So because, again, these forms have private information on them, like names, they need to be kept in a locked file cabinet, some sort of secure storage, and they should be kept for 3 years after the end of the project. And at the end of that period, the consent forms can be shredded. Next slide. You may have other forms, other papers that have participant information on them, like hard copies of the intake forms or the supplemental baselines. Those should be handled according to your organization's or your institution's retention requirements. So the evaluation doesn't have any requirements around those kinds of forms. You should follow your own institution's rules on those kinds of documents. For grantees who are implementing enhancements, that is peer support, emergency assistance, or the non-cash incentives enhancements, those activities will conclude as of September 29th, 2015. Whether you have an extension or not, the enhancements will be coming to an end. And evaluation funding for enhancement activities won't be provided for any activities that occur after September 29th. So you can, bill on your regular schedule for those activities up through the end of September, but there will not be evaluation funding for those activities beyond that point. Next slide. So given that we are in the last few months of the enhancement activity, we'd like you to encourage people who are assigned to the treatment enhanced group to take advantage of the available services until the end of September. We have heard from some grantees that are implementing the non-cash incentives that some of the participants in that component may be kind of hanging on to their points, accumulating larger numbers of points to redeem, and we do want to make sure that people take advantage of the opportunity to redeem those points by the end of September. We will be working with grantees to reconcile any outstanding gift cards. Some folks are using gift cards for various purposes, and we'll be in touch with you about resolving those and catching up on any payment issues related to the enhancements. And we do ask that you enter all data related to enhancements in the PRS for those activities through the end of September, so we make sure we have a complete record of enhancement participation through the end of that period. Okay. There are some ongoing activities for the impact study. We will continue to collect or to conduct brief quarterly monitoring calls with key staff from each grantee just to get updates on any new activities, any changes that we might want to be aware about, and those will continue through the grant period, including any no-cost extensions. So you'll continue to get check-in calls from your site teams. In addition, the control group embargo does continue through the grant period, including any no-cost extension period. So we ask that you continue to enforce that control group embargo. For those grantees that receive grants under the new FOA, they must adhere to the FOA language about maintaining the HPOG impact treatment and control groups through December 2017. So there was a section in the FOA about that. Okay, next slide. So surveys will also be ongoing. Right now, we have the 15-month survey in the field in all of the impact sites. And so the treatment enhancement and control group members are being contacted on the 15th, during the 15th month of their after random assignment. And that data collection will continue through spring of 2016. There also are surveys going on for 4 of the university partnership programs that are listed there on the slide. Even though they're not participating in the impact study, there are surveys going on in those sites as well. Next slide. So what's coming up in the future? There will be a 36-month follow-up survey of participants in the impact study beginning in next spring, in March of 2016. There will not be any further surveys for the university partnership sites, and as has been the case up to now, participants in HPOG programs who were not randomly assigned will not be surveyed, so there won't be any further surveys happening for them.
What?
So I just want to touch briefly on the survey procedures. There are more details about this in the guidance document that we sent out, but we just want to kind of remind people what the procedures are for the 15-month survey in case you get questions from participants in the study or from people in the community about how the survey works. So for the 15-month survey, we send letters at 4, 8, and 12 months after random assignment to the treatment and control group members to ask them for updated contact information, both for themselves and for any alternate contacts that might be folks we could contact if we're unable to reach the participant, so that we can encourage good response rates on the survey. And then just before the 15 months after random assignment, participants are also sent a letter saying that the survey is coming and letting them know that we'll be contacting them for that 15-month survey. Next slide. So the survey method is going to be changing in July, actually as of this week. Up until now, all the surveys were completed by telephone. Our telephone survey center attempted to contact people by telephone. If we were unable to reach the participant or their alternate contacts, we then had local researchers that we call field locators who were assigned to attempt to contact the participant. And then once they located the participant, they would sort of hand off a cell phone to allow them to complete the interview at that time, or make arrangements for the participant to complete the survey by telephone at another time. Next slide. So starting July 7th, the field surveys are now going to be completed by field interviewers who will be using laptop computers. So instead of handing off a cell phone and having the participant complete the interview by phone, the field interviewers will schedule the interview, meet with the participant, ask the survey questions, and then the interviewer will enter responses into a laptop computer. We will continue to do telephone surveys initiated by our phone center, but the field procedures are changing as of this week. So we just wanted to let you know about that. Next slide. So with either of these interview methods, the survey takes less than 35 minutes on average to complete. Respondents do receive $30 to thank them for their time for participating in the survey. The 36-month survey will have slightly different procedures, but generally similar. There are more details about that in the guidance document that we sent out. Again, that wave of surveys won't be starting until March of 2016, so it's still several months away. Okay. And just a few general points about the surveys. Both the instruments and the procedures have been reviewed and approved by Apt Associates Institutional Review Board and by the Office of Management and Budget. All of our survey staff are trained in HPOG study procedures, and they carry identification and a letter that explains the study and the purpose of the survey. That letter can be shared with, obviously with participants, but also with any, neighbors, community members, staff in your organizations who would like more information about the study. Participants are always also informed the survey is voluntary and they can schedule the interview at their convenience. They may also choose not to participate, or they may choose to skip questions in the survey if they prefer not to answer. We do have a hotline, and the number is there and also in the guidance document, and also in all the materials that we send out. If there are any questions or concerns, we're happy to take calls and answer any questions you may have. Okay. This is just kind of an overview of the reporting schedule for the HPOG studies, and this gives you a sense of when the reports are going to be coming out, both for the implementation evaluation, tribal evaluation, and our impact results. So those are the expected report dates for all of those publications. And they will all be available on the Office of Planning, Research, and Evaluation's website. The link is there, so you can watch for them there as well.
I'm on mute.
Okay. And that was all I had to say. You can take questions for either Nathan or myself.
If people have questions, do you just want them to unmute their phones and ask the question, or is there some other that you'd like them to?
I can see the chat screen, so if someone wants to write in, that would be fine. And also, folks should feel free to speak up if you have any questions.
So Nathan, I'll ask a question just going back to the extracts that you're planning to send in two different formats. It would be possible for a person, even if a grantee has multiple sites, if a person is at a site and wanted to extract site-specific information from the extract that you send to them, they could do that without you having to provide separate extracts to each of the individual sites?
Yes, absolutely. So with the standard extracts that we are providing, and again, there'll be Q formats for each grantee by default, and each of those formats that we supply will include the information that you need to do an analysis of your participants by site. So it is not necessary to request separate data extracts by site in order to run that kind of analysis. Does that answer your question?
Yes, I just, and I was asking just to sort of underscore some things that you had already said. And Gretchen, I'm going to ask a question that you already also addressed, but just to make sure it's clear, because you talked about people's regular billing cycles and expending funds. So if people's regular billing cycle, they need to make sure that and any expenses are incurred prior to the end of September, on September 29th. But if their billing cycle means that they're sending you an invoice or whatever mid-October or the 1st of November or whatever it is, that's still acceptable to you.
Yes, that's fine. It's just the activities need to occur before the end of September, but we understand there's a lag in billing sometimes, so that's fine.
Regarding the evaluation, when the evaluators are going out and talking to the students or the participants, are they strictly using the word HPOG, or are they actually using the name of the organization or the facility they were working with while they were working with HPOG? The only reason I ask is because we've had some students that they must have had an evaluator come to their house, and they were kind of scared because they were like, I didn't know what this person wanted, and they were talking about HPOG, but I didn't know it was HPOG because they didn't say anything about the college I worked with, you know, they didn't talk about projects. And so, and then too, with some of the telephone calls, they were kind of like, they said, I didn't know if I should give them the information or I got not given the information.
Okay. So in response to your first question, we do realize that local programs may operate under names other than HPOG, and so we do try to use the local program names in letters that we send out and in contacts that we make with people by telephone. And we can certainly reinforce that with our field staff as well. John and Ben, that may be something that we just need to remind field locators to make sure that they're using those local names as well. And we do make every effort to sort of be clear about the purpose for our contacts with people, but sometimes in particular for people who the contact information that we had may be outdated and we've had difficulty reaching them, field locators will visit, people at the addresses that we may have for them. We do, encourage all the grantees to share with your frontline staff that these field locating efforts may be going on in their area. So if there are any questions that come to you, you'll be familiar with the procedures. We also are also always happy to respond to questions that come to the hotline, any concerns that people have about the field locating.
Yeah, and I think we're posting on our Facebook page that, hey, you may be receiving some people might be coming to your tower, you might be receiving some phone calls. So we're trying to, let them know that those are coming. But we just wanted to make sure that you're using the name of our program versus just HPOG, or HPOG with the name of our program.
Right.
Yeah, this is John Phillips. Yeah, we do train our field staff to use both, HPOG and the program name, but as Gretchen mentioned, we can, reinforce just to make sure that they are using the program name as well.
And I'm sorry, who was it who asked the question, just so I know which site that is?
Penny Morgan with Central Community College Project Help.
Okay, got it. Thank you.
This is Benjamin Phillips. I should mention that there is the informed consent statement, the statement that the Office of Management and Budget requires us to read, does refer to HPOG. So the initial introduction will refer to the local program name. However, the piece that we absolutely have to read as written does describe it as Health Provisions Opportunities Grants, parentheses, HPOG.
This is Nathan. Oh, go ahead.
Oh, so you can use that in the intro, and but then you can also use the other.
Yeah. Okay. Yeah.
All right. So there's a piece that we need to read, that the interviewer needs to read at the beginning of the interview, that refers to Health Provisions Opportunity Grants Program. Initial intro, when the interviewer speaks to the person first, we'll use the local program name, and kind of throughout the local program name there is just this one block of text where, which unfortunately is the most kind of official and intimidating block of text, where the program is referred to by its, name across all the sites.
So this is Nathan, and I actually have a few questions that came in via chat, so I'll go ahead and address those quickly. One of them is, would it be possible to receive the extract data in both formats, composite and also by individual site? And that's similar to what Stan asked, in that if you specify that you want them to be received at each of your sites, then each site will get a disk that has only that site's information on it. It will have both formats, the Excel and the text file, but it will only have that site's information. So you will essentially, if your organization has 5 sites and you ask for extracts by site, each one of those 5 will get a disk, and each of those disks will only have their respective site's information on it. If you have a central organization, we could also send that central organization a disk that has all the information on it. We can do that. So that's to answer that question. And then the other question I received is, at what time do we send our contact information over to receive the data? And PRS support will be contacting you 90 days prior to closeout. They will be contacting our main liaisons at each organization, and we'll be asking at that point, we'll provide you with a little form, and we'll be asking at that point to provide the contact information of the individual who will be receiving the data, and you'll also be indicating at that point whether or not you want the extracts by site. So to reiterate, that's 90 days before PRS closeout is when we will be contacting you. So if you are a grantee with without an extension, it will be 90 days before December 31st. If you're a grantee with an extension, it'll be within 90 days before June 30th, 2016. So that's when we'll be contacting you. And also, I would reiterate that this is all outlined in the PRS information document that we sent along yesterday morning. So if anyone has any questions about that, please contact us at PRS Support. Were there any additional questions? Okay.
Nathan, before wrapping up, I'll throw out 1 or 2 other questions. The main question is, has this webinar been recorded, and will either a recording of the webinar or the slides themselves be made available after today?
Yes, indeed. Both of those will be made available. So we will provide the slides as well as a recording of this webinar. It has been recorded, and we will send out a link to be able to access that webinar recording. And as usual, we also, I just mentioned this, but I would reiterate that for each of the PRS information portion of this and the PRS evaluation closeout activities, there were documents that include all of this information as well. And those were sent in an email yesterday to main PRS or main HPOG organization contacts. So if anyone has questions about those documents or about the presentation or recording, you can send those to PRS Support at urban.org, the usual email address, or call the PRS hotline.
And if there's nothing further, then this seems like a natural time to wrap up.
Yeah, it is. So thank you guys so much for your time and for listening to us. And again, please let us know if you have any questions. And I'm going to go ahead and stop the recording. You can go ahead and contact us if you have anything else to ask.